Owning a pet turtle can be a rewarding experience. Turtles are fascinating creatures, but sometimes they can be tricky to read. How can you tell if your turtle is just resting, or if something is seriously wrong? Let's explore the signs that can help you determine if your turtle is, unfortunately, no longer with us. It's important to remember that turtles are cold-blooded. This means their body temperature depends on their environment. As a result, they can slow down significantly when temperatures drop. This can sometimes make it seem like they're gone, even when they're not. Don't panic right away if your turtle seems unresponsive. We'll guide you through the steps to check on your turtle's well-being. We'll also discuss when it's crucial to seek help from a veterinarian. One of the most obvious signs that a turtle has passed away is a lack of movement. Turtles by nature are not the most active creatures, but even the slowest of them will show some signs of life. If you observe your turtle, and it remains completely motionless for an extended period, this could be a strong indication that something is wrong. It's important to differentiate between a turtle that is simply resting and one that has passed on. Turtles are known for their slow and steady pace. They may not be the fastest animals, but they do move. A healthy turtle will exhibit some form of activity, whether it's slowly walking around its enclosure, moving towards food, or even just shifting its position occasionally. But a healthy turtle will move at least occasionally. Even in water, where they are more agile, turtles will swim or float around. On land, they might crawl or explore their surroundings. If your turtle is not showing any of these behaviors, it could be a sign of distress or worse. If your turtle has been completely still for an extended period, it's a cause for concern. Turtles do have periods of inactivity, especially during brumation, which is similar to hibernation. However, if your turtle is not in a brumation period and remains motionless for hours or even days, it is essential to check for other signs of life. Another clear sign is a lack of breathing. Turtles, like all animals, need to breathe to survive. Observing the turtle's nostrils can give you a clue about its respiratory status. You can check for breathing by observing the area around the turtle's nostrils. Place your hand near the nostrils to feel for any air movement. Sometimes the movements are very subtle, so it requires close attention. Look for any subtle movements that indicate respiration. Even the slightest movement can indicate that the turtle is still alive. If you are unsure, you can also use a small mirror near the nostrils to see if it fogs up, indicating breath. If you don't see any signs of breathing, your turtle might be gone. It's a heartbreaking realization, but it's crucial to be certain before making any decisions. The eyes are another indicator. A turtle's eyes can tell you a lot about its health and vitality. A living turtle will have clear, bright eyes. These eyes will be alert and responsive to movement and light. A deceased turtle's eyes will appear cloudy or sunken. This change happens relatively quickly after death and is a clear sign that the turtle is no longer alive. This is a natural part of the decomposition process. As the body begins to break down, the eyes lose their clarity and become dull. Finally, check the turtle's shell for any foul odors. The shell, while protective, can also trap smells from a decomposing body. While turtles don't have a strong scent, a decomposing body will emit a distinct and unpleasant smell. This odor is unmistakable and is a strong indicator that the turtle has passed away. If you notice this, it's a strong indication that the turtle has passed away. It's important to handle the situation with care and respect, as the loss of a pet can be a deeply emotional experience. If you are ever in doubt, consulting a veterinarian can provide clarity and guidance on how to proceed. Turtles, especially certain species, are known for their ability to hibernate. This fascinating process allows them to survive in environments where temperatures drop significantly, making it difficult for them to maintain their normal metabolic functions. Hibernation is a state of inactivity that helps turtles conserve energy during colder months. By slowing down their metabolism, they can survive on the energy stored in their bodies, which is crucial for their survival when food is scarce. It can sometimes be confused with death, as the turtle's bodily functions slow down significantly. This dramatic reduction in activity can make it challenging for even experienced turtle owners to determine whether their pet is hibernating or has passed away. During hibernation, a turtle's breathing and heart rate will slow down considerably. Their body temperature drops to match the surrounding environment, and they enter a state of torpor, which is a deep, sleep-like condition. They may appear lifeless, but they are still alive. This state of dormancy is a survival mechanism that has evolved over millions of years, allowing turtles to endure harsh conditions that would otherwise be fatal. This is where careful observation is crucial. By paying close attention to subtle signs of life, such as slight movements or changes in breathing patterns, you can determine whether your turtle is hibernating or in distress. If you're unsure whether your turtle is hibernating or deceased, it's best to consult with a veterinarian. A professional can perform a thorough examination and provide you with the peace of mind that comes from knowing your pet's true condition. There are key differences between hibernation and death. Understanding these differences can help you make informed decisions about your turtle's care and ensure that you provide the best possible environment for their health and well-being. A hibernating turtle will still have a slight reaction if you gently touch its shell or limbs. This response is a sign that the turtle is still alive, even though it may be in a deep state of torpor. They may even retract their head or limbs slightly. These movements, although minimal, indicate that the turtle's nervous system is still functioning, and it is capable of responding to external stimuli. A deceased turtle will not respond to any stimuli. If you notice that your turtle remains completely unresponsive to touch or other forms of interaction, it is likely that they have passed away. Another difference lies in the turtle's eyes. The condition of the eyes can provide important clues about the turtle's state of health and whether they are hibernating or deceased. While a hibernating turtle's eyes might be closed or partially closed, they will still appear relatively clear. Clear eyes are a good indication that the turtle is in a state of hibernation rather than having succumbed to death. A deceased turtle's eyes will be cloudy or sunken, as mentioned earlier. These changes in the eyes are a result of the body's natural processes after death and are a clear sign that the turtle is no longer alive. Section 4. Wake-up call. How to check if your turtle is alive. If you're unsure whether your turtle is alive or dead, there are a few things you can do to check. Turtles can sometimes be very still, especially when they are sleeping or brumating, which is a hibernation-like state. This can make it difficult to determine if they are alive or not. Always handle your turtle with care, especially if you suspect it might be deceased. Rough handling can cause stress or injury to a living turtle, and it can also damage a deceased turtle's body. First, try gently touching the turtle's shell or limbs. Turtles have a natural reflex to withdraw into their shells when touched, so this can be a good indicator of life. As mentioned before, a living turtle will usually react to touch, even if it's just a slight movement. This reaction can be very subtle, so make sure to observe closely. Be patient and observe closely for any signs of life. Look for small movements, such as the turtle's head or limbs twitching or its eyes blinking. Sometimes a turtle may take a few moments to respond, especially if it is in a deep sleep or brumating. Next, try offering your turtle some of its favorite food. Turtles have a strong sense of smell and are often attracted to food, even when they are not feeling well. Place a small amount of food near the turtle's mouth and see if it shows any interest. You can try using a variety of foods, such as leafy greens, fruits, or commercial turtle pellets. A hungry turtle will often try to eat, even if it's feeling unwell. If your turtle starts to eat, it's a good sign that it is alive and responsive. If your turtle is aquatic, check the water temperature. Turtles are ectothermic, meaning they rely on external sources of heat to regulate their body temperature. Turtles are cold-blooded, and cold water can make them sluggish and unresponsive. If the water temperature is too low, your turtle may appear to be lifeless. If the water is cold, try gradually warming it up to see if your turtle becomes more active. You can do this by adding warm water to the tank or using an aquarium heater. Make sure to monitor the temperature closely to avoid overheating the water. Another way to check if your turtle is alive is to observe its breathing. Turtles breathe through their nostrils, and you may be able to see slight movements in their chest or nostrils as they breathe. You can also use a flashlight to check your turtle's eyes. Shine the light gently into the turtle's eyes and see if there is any reaction, such as blinking or pupil constriction. Gently moving the turtle's limbs can also help determine if it is alive. A living turtle will usually have some resistance in its limbs, while a deceased turtle's limbs will be limp. Finally, you can check for a heartbeat. Place your fingers gently on the turtle's chest, just behind the front legs, and feel for any signs of a heartbeat. This can be difficult to detect, especially in smaller turtles, but it can be a definitive sign of life. By following these steps, you can determine if your turtle is alive and take appropriate action if needed. Remember to always handle your turtle with care, and consult a veterinarian if you have any concerns about its health. Section 5. When in doubt, call the turtle doctor. If you've checked for signs of life and you're still unsure about your turtle's condition, it's crucial to consult with a veterinarian immediately. A veterinarian can provide an expert opinion and determine the best course of action. Don't try to diagnose or treat your turtle yourself. Turtles can be delicate creatures, and improper care can do more harm than good. A veterinarian has the knowledge and experience to properly assess your turtle's health and provide appropriate treatment if needed. When you take your turtle to the veterinarian, be prepared to provide as much information as possible about your turtle's history, including its diet, living conditions, and any recent changes in behavior. This information will help the veterinarian make an accurate diagnosis. Remember, it's always better to err on the side of caution when it comes to your turtle's health. Don't hesitate to seek professional help if you have any concerns.